Hello and welcome to Health Show with Amara from our London studios. I'm here again with a very important health related topic, infertility. To be a parent is a natural instinct and a human prerogative to procreate. But unfortunately, not everyone is lucky to have natural conception like others, and therefore it is important to talk about it. In addition to that, it is also important to discuss this in order to mitigate the gender inequality when this topic is being discussed. And the reason is that when the couples are failing to conceive, so the misconception is that it is a female problem when actually it is 50-50 chance that the problem could be either with a male or a female. And not only that, it's not just about the couples, but there are some people who for some reason are unable to have natural conception because they have had some treatments for cancer or other ailments where it becomes difficult for them to have natural pregnancy. And in this day and age, there are some same-sex couples who are trying to conceive through unnatural ways, so this topic becomes very important. So female infertility is talked about a lot, but today we are going to focus on male infertility, and for that we have invited in our studio today a consultant urologist from London who is going to tell us about male factor infertility. Let's welcome Mr. Said. Hello, Mr. Said. Welcome
Hi.
to our studios.
Hello, Amara. Thank you very much for giving me the privilege to come and talk to you in the studios today. And as you've rightly said, that it is a very important topic because we need to be aware, create awareness in people that it's nearly half the problems with infertility lie with males. 1 in 7 couples are struggling to conceive, and there are about between 70 and 80 million people around the world who suffer with infertility issues. And as long as the male is able to have a relationship and perform, usually conceived as there's no issue with the male, it's got to be the female. That's where the things are not right. It's, as I've said, it's a 50-50 participation, and my opinion, it is probably best to start investigations for infertility in men because it's relatively simpler and the causes can be rectified quite easily with very simple maneuvers.
So do you see a lot of men being investigated and referred to you for investigations when there is a problem, and how do they take that concept that there could be an issue with them and that the reason why they're not able to conceive?
Well, the first part of the question, I see a lot of men, yes, because it is my specialty. I like to see men who have been referred. Now, in the beginning, I would expect that when the whole process of investigation starts, you're a gynecologist yourself, you'll know that there is an issue with trying to instigate men to step forwards and to get themselves to get investigated, and that I understand from the histories is always an issue. Starts off with the GP's practice, goes on to the gynecologist, and then that's where the whole thing gets started. And then men, by the time they come to me, the men, they have already either have had a sperm count that has shown that they have a low sperm count, or they have been inspired enough by various resources that they should go and seek advice from a specialist.
And what are the common causes that you come across that leads to male infertility?
There are a number of causes. In order to have a full understanding, I think it's important to give you a little bit of a brief on to the normal physiology of sperm production. Sperms are produced in testes, as we all know. They sit outside the body, although they are internal organs. They are affected by hormones which stimulate the production of sperms, and also by other hormones that stimulate the production of testosterone, which is very important in the production of hormones. Then once the testes have produced the sperms need to then be transported from the testes through number of tubes, ultimately for the process of where the fertility takes place. So there could be problems in either of these steps. There could be a problem with the hormones, which is not allowing the testes to produce sperms. There could be a problem with the transportation of sperms, either not enough numbers are being produced or they're not being transported properly, or there is a restriction, there is obstruction that is interfering with that, or finally the sperm that are being produced, they are not in a definitive good quality. They are not able to travel to fertilize the ovum. So all these things, they start off with very simplistic approach, a good history. Patient comes to the clinic. You have to take a good history about starting from childhood. Immunization, the child had the normal milestones in life, the testes were present in the sac, if they have had any operations, have they had immunization, have they had any diseases, childhood diseases like mumps or tuberculosis or any other problems, any injuries in the genital area, any infections in that region, or exposure to unexpected medication, pesticides, chemicals, industrial chemicals. All these have got effects on the production of sperms and fertility in the later life. Then a clinical examination is very important. You need to see whether both the testes are present in the scrotal sac, because for optimal production of sperms, the testes need to be at a very optimal temperature, below the body temperature. Otherwise, they will not produce adequate number of sperms and adequate quality of sperms.
So what do you mean by the quality of sperm? So what is the poor quality? How would you describe a poor quality sperm?
Well, it's a simple test, as I've said, a semen analysis where the sperm specimen is submitted to the lab, and they put it under the microscope within a short period of time. So what they're looking at is the morphology, which is the actual appearances of the sperms, and their motility, how quickly they move, and their directional motility, whether they're moving straight or they're all haphazard random directions, and also their ability and the survival, the duration, plus their the quality of the semen that has been produced, that is also playing an important part. Its acidity is important. It's the amount of nutritional elements which are present, like fructose. All these things are analyzed, albeit in more sophisticated manners, if we find that there is an abnormality in the sperms.
So when they are advised to have the test, are there any special instructions that are given to men before they collect the
Absolutely,
sample?
because the thing is that sperm quality varies from time to time, and from the time of the day to the time of the night, and also on the sexual activity. So the instructions we normally give is that semen specimen has to be produced generally in the early morning time, when the patient has had the night erections and morning erections, and there has been enough stimulation. And 2 days of abstinence from sexual intercourse is important as well, because 48 hours is the optimal time, and that's where we will be able to see and judge and also try and form a method of further investigations.
So when, if let's say that you have detected a problem with the quality, then what is the next step? What do you do with that? So do you give any special
First of all,
advice?
we need to differentiate. We need to know whether there is any sperms present in the specimen or not, or if there are sperms present in the specimen but they are not optimal. either of the situations, there's good quality, poor quality sperms, that can be improved by very simplistic measures. As I've said, temperature is a very important factor. We need to rule out presence of dilated blood vessels. That will be elaborated on the clinical examination. This is called a varicocele, that raises the temperature of the testes because of the faulty valves and stagnation of blood around the testicle. That can be corrected by a surgical operation. If the patient is working in a very hot environment, for example, he's a chef constantly exposed to high temperatures from the ovens and from the burning stoves, they need to be in an environment which is cooler, and they need to be making frequent visits to the bathroom to go and wash themselves, especially in their private areas, with cold water, so that they can keep the temperature as low as possible. Then some people have got the habit in winters to sit on a radiator, which is again a lot of heat going up into the genital area. And I recall a case where an engineer used to sit on that. Before he came to see me, I went to see him with my car, and I told him that you shouldn't be sitting there because this can cause infertility. And he said, "Doc, this is amazing. I'm coming to see you in 2 weeks for the same problem. I have infertility." And when I saw him, his wife had already conceived because he had stopped sitting on that heated
So that's
radiator.
simple. So, I mean, the general advice that you would give to men in order to improve their chances of conceiving, because it's not nice guidelines do not recommend referral before 12 to 18 months if a couple is not conceiving naturally. So, the general advice you would like to give to the public?
Well, I mean, as I've said already, there are multiple other factors as well that have not been able to bring it into this picture just yet. But most important things are the men, they need to have a healthy lifestyle, regular exercise. They need to be able to try and keep their genital areas in a colder environment rather than exposing them to a direct heat irradiating. They may trial with multivitamins, especially the products that contain zinc, selenium, and other important vitamins.
That should be available in the general.
Generally, if you look at it, zinc and selenium, they are very good. And vitamin E. These three
and
products
that should be
present.
provided in the diet. If you eat healthy diet, then it should be a good supply for all these multivitamins.
If they smoke, they need to stop smoking. If they're indulgent in alcohol, they need to stop the alcohol. If they're taking any other recreational drugs like marijuana, they should be abstaining from that. Testosterone supplements. A lot of men are into bodybuilding. They take a lot of testosterone. That is a killer for sperms because extrinsic testosterone interferes with the natural hormone productions, and it definitely reduces the intratesticular testosterone, and the sperm production comes to a rock bottom.
So, I mean, we often see for females when they are going through a hard time, not being able to conceive naturally, it leads to a lot of psychological or emotional turmoil for them. So, do you see that in men as well? Or men are very hard and they are not expected to grieve about any problems in their lives?
I think that's the general concept about men. I think men are even more sensitive than women. And the couple, they suffer as a pair. You cannot individualize one person is suffering more. Yes, there is a certain amount of anxiety in women, which is more because they feel that the time is not on their side. They're aging every day, their hormonal levels are changing, their ovulatory cycles may be affected, whereas for men, it is taken for granted that they will. But then there are men who do not have sperms, and they are the ones there are surgical procedures that are available, which is more specialized, we can go into it, but there are surgical procedures available with IVF. In vitro fertilization.
Okay, so I mean, it's just have you ever had any man who was referred for a psychological support, because women often do request for that. Have you ever come across any man who wanted to be offered some counseling? Or
I think the men probably need counseling at that point anyway, because their partners are undergoing a lot of stress, and they are finding it difficult to cope with the stress, and some of the couples are actually trying so hard that they're not even taking into consideration that the optimal sperm production, sperm numbers are available after each 48 hours after ejaculation. So if they're doing it much more frequently, then obviously the sperm numbers and the quality and everything will deteriorate. So this is a part of the counseling as well.
okay, and we know that in women the quality of eggs deteriorate with advancing age. So does age affect male fertility as well?
Yes, it does. It reduces the sperm count, the morphology, their ability to move around, and their motility, all are affected by age. And then there are superadded factors, for example, diabetes or pre-diabetic conditions, equally bad for spermatogenesis. Then we have the metabolic syndrome, where men are obese, high cholesterol, hypertension, vascular conditions, and central obesity, all these things. And then again, this infertility is a part of metabolic syndrome as well.
Okay, so what you're alluding to is that healthy lifestyle is the most important thing when it comes to counseling a couple, because we are talking mainly about couples and not necessarily those with any health related issues resulting in infertility, or same sex couples. So healthy lifestyle. And do you think that this positive approach of like thinking positively and avoidance of all these negative thoughts, does it play any role? Is there any evidence that it plays a major role in how couples cope with the delay in conceiving naturally?
Well, I mean, again, there is this issue that we were talking about, the causes, and another way of going around, and another branch of the causes. It comes out, springs from the fact that the couple are having some turmoil in their relationship. The female counterpart is quite enthusiastic. He's finding it undesirable to be able to perform on demand and when she wants it. A lot of times he may have problems with ejaculation. Erectile dysfunction springs from the same issue, that when you're too enthusiastic and the female partner is quite aggressive about having to force him, that can result in erectile dysfunction. That can be one of the causes where he's not able to ejaculate adequately or loses his erections. So yeah.
So what I'm understanding is that it requires a lot of understanding and support for each other when the couples are going through such a scenario, because it's not about blaming someone, it is just about identifying a problem, whether it is a male factor or a female factor, and then focusing on the right treatment, on the right path, without blaming each other. I think this is very helpful. Is there any other advice you would like to give in general for the couples who are struggling to have natural conception?
Well, I mean, the thing is that it is sometimes, a lot of times we can cure the problem by simple measures. It's no rocket science. It's day-to-day thing. If there is a tumor or a cancer, we can treat the cancer, and that can bring back normal fertility. If we have a surgical cause like a varicocele or undescended testes, it can be brought down. It can sort it out. If we have another issue, for example, it's a genetic thing, number of genetic causes can cause, which can not cure the problem, but it can be treated.
Okay.
With the modern methods that we have in artificial insemination and IVF treatments, these problems can be tidied up and it can still be treated.
So yeah, that's very useful to know. And what I hope the viewers have understood that in this day and age, there may be a delay, but no couple or no human being should consider infertility to be a stigma or something that can't be sorted. So thank you very much, Mr. Said, for your very interesting and very elaborate views on male infertility and how to rectify the problem, and main emphasis on the healthy lifestyle. Thank you very much for your time.
Thank you very much for inviting me.
I hope you found this topic interesting and useful. So viewers, see you next week with another important topic. Until then, goodbye.